Afternoon, everyone. My name is Elaine Belson. I am a licensed clinical social worker, and I have been one for 30 years, including the Army. And I am here to answer your questions, those burning questions that you've always wanted to ask a therapist. So I just want to start by saying just a few reminders. This is a live feed, it's being recorded, however. Advice given on this show is for informational purposes only and is not intended to replace professional, psychological, or medical advice, diagnosis, or treatment. Questions and concerns about your mental health should always be discussed with a qualified professional. Any use of this information is the sole responsibility of the listener. If you are having thoughts of harming yourself or someone else, call 988 or go to the nearest emergency room. So until I have anyone on the chat asking questions, I am going to answer some questions that I get a lot in my work because I have a thriving therapy practice that I see patients 5 days a week, Monday through Friday, and I've been doing that for decades. So one of the questions that I often get from people, especially in the first session, is, am I crazy? Right? And what I find is that people often have this fear that there's something inherently wrong with me. And it's so common that it seems universal. And I think there are some common, what I call feelings of inadequacy. I'm not good enough, I'm not deserving, or there's something inherently wrong with me. And they're constantly looking for verification or validation that there isn't, right? Um, and so I think where that fear or where that question is coming from is this fear. Is there something inherently wrong with me? And one of the things I always say to people when they ask that question, and, am I crazy? I say, if you were, you wouldn't have been asking the question. Because, someone who is what we call psychotic or has psychotic symptoms doesn't recognize that their thinking is distorted, right? So if you have that question in your mind, it's what we call intrusive thoughts. That means they feel like they're coming from outside of you, and you have questions about them. So you feel self-conscious about them. So that tells you that you're not crazy. But the fact that you ask that question and you wonder about it, and you catch yourself often wondering if there's something inherently wrong with you, that's all very common, right? I hear it all the time. Kind of related to that is the question, is it just me? Right? And I can tell you from doing this work for 30 years and dealing with hundreds and hundreds of people that it isn't just you. There isn't anything that you're going to tell me or report or feel that I haven't heard many times before. And why? Because this is all part of the human condition, right? Everything that you're experiencing is part of being human. And so I think one of the reasons, though, however, that we wonder these things is because we live in a society that doesn't talk much about mental health. We don't talk much about feelings, and we don't learn a lot about mental health and what's normal. And so people feel isolated. They think I'm the only one. And it becomes a vicious cycle because they don't want to talk about it because they think they're the only one, right? And again, they think there's something inherently wrong with them. So one of the things that I hope to do just by doing the show is to break through some of that stigma and to normalize that. You're going to see the questions that other people ask are the same questions that you have, and that you'll find out that you're not alone at all. But one of the biggest concerns I have about this is the stigma is it leads to feelings of isolation. People don't talk about their problems. They think they're the only one who has it. And so it creates this feeling of isolation, which I think in turn contributes to an increase in suicide rates, which we have seen, particularly between the ages of 10 and 24, which is really sad. And then it also has contributed to what has become a serious condition in our society, chronic loneliness. In fact, the Surgeon General put out a report about loneliness because it's become such a problem. So you are not alone in your loneliness, right? So I'm going to go down to some of the other questions that I get a lot um, from people. One of them is, why am I so hard on myself? And I particularly get this from women. And when women ask me this question, I say, yeah, you and every other person with two X chromosomes, because it's so common in women. And what I want to explain to you is the reason that you hard on yourself, the reason why you people please, is to think of this as chocolate cake. And the reason I say that is because sometimes when we're upset about something, we might reach for chocolate cake, right? Food, right? To either give ourselves, to comfort ourselves or reward ourselves, right? And so when you are hard on yourself, it's just like eating chocolate cake. In other words, it's just another coping mechanism, right? So, what you're trying to do is you're being hard on yourself because you're trying to cope with an uncomfortable feeling. And what that uncomfortable feeling is could be anxiety, it could be depression, it could be loneliness, it could be feeling overwhelmed, it could be anger, any number of feelings. So we often use, just going to turn off my ringer here. We often use being hard on ourselves as a way of trying to deal with uncomfortable emotions, particularly, I would say, anxiety. So being hard on yourself is just one of several types of what we call ruminating, right? Ruminating is when, you just think something over and over and over again. It's just like negative thinking on us in a cycle, right? Particularly like when we're trying to sleep, for example, right? Or when we're worried about something. So we start ruminating. And so types of ruminating are mind reading, like trying to read someone else's mind. What are they thinking? Anticipating other people's reactions. What is this person going to think of me? Um, Rehashing. Why did I do that? Maybe I should have done it this way. Second guessing. Was that the right thing to do? Um, uh, Self criticizing. I'm worthless. I'm stupid. I'm unlovable. There's something inherently wrong with me. um, Comparing oneself to others. Why don't I look like this person, or why don't I as successful as that person, or whatever, right? So those are examples of what we call ruminating, right? And so when we talk about being hard on yourself, right, perfectionism, all of that, ruminating is chocolate cake. So there's a feeling first, let's say anxiety, and then you're trying to cope with that feeling. And so what you do is you ruminate, right? The problem is, just like with chocolate cake, it might make you feel better in the moment. It might make you feel like you're gaining control of the emotion, but you're not. And in fact, you're making it worse. It's just going to increase your feelings of anxiety or depression right? Or feeling overwhelmed, right? And so instead of reaching for that ruminating, being hard on yourself, right? You need to do something else, right? And that's one of the things that I teach people is what do you do instead of being hard on yourself, people pleasing, second guessing, mind reading, anticipating, being perfectionistic, right? All of those things. What do you do instead? Well, first of all, whenever you catch yourself ruminating, what that's telling you is there's an uncomfortable feeling that you're trying to cope with, right? So the first thing that you want to do is you want to identify that uncomfortable feeling, right? And label it. So I'm telling myself, if I'm not perfect in this interview, then I'm don't deserve the job. Okay. So what are you feeling underneath? You're feeling anxious, fear of failure, right? And so um, the best thing to do is to label the feeling. Okay, I'm feeling anxious. And then the second thing that you want to do is then identify specifically what is it that you imagine could happen. And here's where it's really important to be specific. It's not like just, well, I'm not going to get the job or make a fool of myself. Are you afraid that you're going to stutter or have a panic attack in the middle of this interview? Are you afraid that you're going to forget to not know the answers to certain questions, etc. Right? And so the reason why this is important is because this is the reason why we have feelings. We have feelings to get us to problem solve, right? But you can't solve a problem if you don't understand it. So we want to label the feeling and then we want to identify what specifically is provoking that feeling. What specifically is it that I'm afraid of, right? If it's, anxious, anxiety about an interview. And so the more specific you are, then you can go to the third step, which is problem solving and asking yourself, what's in my control? So, and to be proactive, right? To be proactive, to prepare in advance, to think this through, and then do what's in your control. And so that is why we have feelings. We have feelings for the same reason that we have pain and hunger. It's information that of a threat or of a need that we're overlooking, right? So just like if I touch a hot stove, I feel pain in my hand because if I didn't, I would leave my hand there, right? And then I would burn my hand. If I didn't feel hunger, then, I might starve myself to death if I didn't eat for days, right? So we have feelings for the same reason. You have to think of them as information of a need or a threat that you're overlooking, right? And so that's why it's most important to ignore the ruminating and go directly to the feeling because that feeling is trying to help you. It's trying to tell you something. And depending on what the feeling is, it's trying to tell you something different, right? And so, whatever that feeling is, once you label it, then you can ask yourself, what specifically in my life, what specifically is going on that is causing this feeling, that's creating this feeling? So, I want to talk a little bit about anxiety since we were just talking about it and coping with it. And it's often a common cause of ruminating, right? Or as we like to call it, worry. So, worrying and anxiety are often lumped together under the same category, but they're not the same at all. Anxiety is an emotion, worrying is a thought process, right? Anxiety is innate, right? We have feelings for a reason. We evolved to have feelings. Again, this is a survival mechanism, right? And so worrying, however, is a coping mechanism, but it's a negative coping mechanism. It's a maladaptive coping mechanism, right? So what I tell people is that you do not need to worry. And it doesn't mean that you're not going to feel anxious, but worrying is not a constructive way of dealing with your anxiety. And I can teach you other ways of dealing with your anxiety, which will help you to actually reduce your anxiety. So, why do we have anxiety? Usually, it's to tell us that we're feeling out of control about something. And what I have found is that there's three types of anxiety or fear. There is fear of rejection, fear of failure, and fear of harm to self or others. And usually, when someone tells me that they're anxious about something or afraid of something, it's going to fall into one of those categories. So that's really helpful to think about. So, anytime you catch yourself feeling anxious, you can say to yourself, number one, that must mean I'm feeling out of control about something. And number two, it's going to fall into one or more of these categories. And so already you are starting to be proactive. You're starting to problem solve. And that's exactly why you have anxiety. It's there to tell you, hey, there's something threatening that you're overlooking, right? Or there's a need that you're overlooking. And so once you've identified that it's something that you're feeling out of control about, what then you can ask yourself, what am I feeling out of control about? And specifically, what am I feeling out of control about that has to do with rejection or failure? That I could be rejected in this situation or could fail in this situation. And again, you want to be concrete. You want to get down to the specifics. You know, I'll give you an example. I had 3 patients, all teenagers, that had a test coming up that they were feeling anxious about. And, I could have just left it there and said, well, you need to study of your, how much time do you have? Have you been studying for it? And just made that assumption that they're afraid of failing the test because they won't have been prepared, right? But I know better than that. And I know people are complicated, more complicated than they give themselves credit for. I always say, if it were easy, you would have figured it out already, right? So if you're struggling with it, it's because you're complicated. Human beings are complicated. So in one case, the reason that this teenager was feeling anxious was because she was afraid that she was going to have a panic attack in the middle of the exam. Okay. The second teenager was afraid that she was going to forget the material. Not that she wouldn't study, but that she would be there and then all of a sudden it would just all leave her head. And then the third was afraid that she would not understand the questions because in a previous exam, that's what happened. She realized after she went over the exam that she misinterpreted some of the questions. So in each one of those cases, they all felt anxious. There was all fear of failure in taking an exam. But the reasons why, the underlying reason, the specifics were different, very different. And because of that, the interventions are going to be very different. And in fact, I have lots of different mantras. And one of them is just because you see a person two people walking across the street, going in the same direction at the same time, it doesn't mean they're heading to the same place, right? I haven't gotten any questions yet. So I will talk a little bit more about anxiety and another one of my mantras, which is you don't have a crystal ball to see into the future, but what you can have is a toolbox full of coping skills to take with you wherever you go. So, what do I mean by that? So, we can't predict the future, right? There's life is full of uncertainty. So, we can't predict the future, and we can't control every variable, right? But what we can do is arm ourselves with coping skills so that no matter what comes our way, even if it's was unpredicted, we can say that's okay because I've got a tool for that, right? So you don't have to predict everything. You don't have to anticipate every outcome and control every variable, which you can't do anyway. It's not realistic because you know that you will get through it. No matter what it is, you will manage because you have the coping skills. And so that's one of the reasons why I am doing this uh, podcast and answering your questions and wanting to spread this knowledge to as many people as possible because I want to arm your toolbox with as many tools as possible to empower you to make good decisions. The more coping skills you have, the better off you will be, the more prepared you are for whatever comes your way. And I'm sure you all know, everyone I think knows someone who doesn't have a lot of tools in their toolbox, right? They may have a hammer, a screwdriver, and a wrench. And no matter what the situation is, they're going to go back to those same coping mechanisms, right? Because that's all they know. And no matter how much you try to reason with them and explain to them that this is self-destructive, they don't know any other way. Those are the tools in their toolbox. When we know we have this toolbox with us, this is what gives us a sense of control over our world. Again, it's not by worrying, it's not by anticipating. That is not the way to gain a sense of control. The way to feel in control of your world, and to have a sense of mastery of your life and to have a sense of confidence is through that toolbox. It's by knowing that no matter what comes my way, I will manage because I have all of these coping skills, right? And so in the future, we will talk a lot about what those coping skills are. There's lots of different coping skills. And I find that they fall into three categories. One is changing something about the situation, right? So let's say that you're frustrated about rush hour traffic. You could talk to your boss about, can I work from home or could I change my hours so that I don't have to deal with it? That would be an example of changing something about the situation. And oftentimes we turn to that first, but it's the one that's the least in our control. We often don't have that much control over certain situations or people. The second one is setting boundaries and asserting yourself, right? Which is avoiding unnecessary stress, right? And the way to avoid unnecessary stress is by setting boundaries and asserting yourself. So saying no, right? Or saying I need, right? And so that's the second coping strategy or category. The third is the one that's 100% in your control. And it's the one that people know the least and rely on the least. And that is changing the way that you cope emotionally, cognitively, and behaviorally. And there's just a whole ton, of different coping skills in this category. And a lot of times what people will say to me when they first start seeing me is, there's nothing in my control. And by the end of our work together, they're saying, I learned that there's a lot of things in my control. And that feeling of empowerment is so important because feeling in control is part of being human. It's a basic human need. No, you're not a control freak. That's just everybody needs to feel in control. That's a basic human need. So I will stop for now and invite you to submit questions underneath this video. And please enter your questions under comments, and I will be more than happy to answer some of them. So I look forward to also hearing from some of you or meeting some of you live. I will be doing this again every Friday. So next Friday at 12 noon. So I will see you then. Thanks for listening. And subscribe so that you get a notification in the future. And so you'll get a reminder that of the 12 o'clock Friday live conversation.